Good afternoon, students. So today I'll be discussing the regulatory aspects of artificial intelligence in clinical use. Are you ready? Let's get started. Imagine the world of AI where machines don't just assist in healthcare. They learn, they adapt, and they get better over time, much like a doctor improving with experience. I'll start with an example. A 42-year-old diabetic woman visits the OPD for a routine fundus screening, and the AI-based fundus camera detects moderate MPDR. But can you see the image here? It's blurred. So the clinician is at stake. Whom should he trust? His instinct or AI? This is where regulation actually matters. Let's move to real life scenarios. Can you name the person here? Anyone? She's Patricia Goncalves. She was a legally blind person, underwent world's first AI-based laser surgery and got the vision of 20/16. And on the right-hand side, you can see a very recent AI-verified X-ray report from a prestigious institute. It was not valid. Why? It was not signed by a radiologist. This mandates the need for artificial intelligence regulation. So this is my lesson plan, and I'll begin with the actual definition per se. So regulatory aspects, they are the rules and data that ensure safety, efficacy, transparency, and accessibility. So basically it is like a safety seat belt, not only for the patient, but also for the clinician, which is very much necessary nowadays. Now, these are the global regulatory guidelines, as you can see. The US FDA, the European Union, the UK Act, they paved the way for the Indian ones. So in India, we have the Central Drug Standard Control Organization, which classifies AI devices as software devices. And we have the Niti Aayog to make AI transparent for all. We have the ICMR, which focus on the ethical aspect, and the National Digital Health Mission to ensure that it is the frameworking of the digital data network is safe. So these are the legal frameworks. What started in 1940 as the Drugs and Cosmetic Act now stands at the latest CDSCO draft in October 2025. So according to that, we have the stepwise approach. So first we'll define the intended use. We'll classify the risk, then validate with the Indian data set ICE. We'll submit it, get the license, and then comes the real world surveillance. So this actually was validated by October 2025 draft. And then we have the risk-based classification. So class A and B are basically, what are they? They are the low and moderate risk ones. And the higher classes, you know, they are the diagnostic modalities, and the lower classes, they come under the state, and the higher classes comes under the central licensing authorities. So I'll give you an example. Can you name this device? Anyone know this device? This was developed in India. Anyone? Yes, very good. This is Remedio. It is for screening. So what class does it belong to? Low risk ones, moderate risk ones. So what class? Class B. Very good. Now I have to speak a few words about India AI mission. So this is like the flagship program for us, a big bang moment, because we want to make India the global AI leader. So we are computing on 7 pillars. And next, you know, the regulation is necessary. So does ethics. So ethical aspect is important. Why? We need to make AI safe. We need to make AI accessible, trustworthy. And finally, I've come to the Digital Personal Data Protection Act. Do you know what this is? Everything is digital nowadays, right? So the patient has the right to give the consent, and the patient has the right to withdraw at any point of time, and any breach, there will be a penalty up to 250 crores. So there are challenges and solutions. In one side, we need much more regulatory clarity. There is the implementation cost, and how do you prevent it? We need much more educational programs, right? We have the India AI mission. So, you know, we are now living in an AI augmented era. AI is revolutionary, but it must be regulated. We have a very robust framework now, but it is the clinicians. We verify, we validate, we interpret. AI just assists us. It is the clinicians who decide. So I know this is a bit of a high-end topic. You should learn your lesson today itself. Any doubts, you can ask me now. Thank you.
Ma'am, I was using ChatGPT for most of the tasks that I do. I just added an image of diabetic retinopathy to ChatGPT and it gave me the answer. Can I do it for the patient? Because is it allowed that with the patient, without the consent of the patient, can I share it for?
Actually, that's a good question, but the answer is no. The problem is ChatGPT, yes, it is very useful for getting small answers, but there was a recent study was done from an institute, which there was a mock patient, and actually they asked the ChatGPT what to do for the patient as a treatment, and that was like the end stage of the patient, and the ChatGPT actually told to the patient to die by himself. So that is the problem. They are not giving the treatment modalities all the time. You can't entirely trust on ChatGPT.
Teacher, I didn't understand anything. I will come to you at home and understand.
Yes, the thing is lots have been done in this field. It's an evoluting field, and lots have to be done. So after class, we'll discuss, okay?
Ma'am, are there any softwares available which are licensed to be used for diabetic retinopathy?
Remedio is actually good and much more modalities are coming. But in India now, Remedio is the only thing that has been regulated. Much more modalities are coming nowadays.
Any role of AI in research?
Yes, AI is there in research. We have Perplexity, we have ChatGPT, we have Gemini, all these things are there. But, the regulatory clarifications are not much, it is like evolutionizing. So we don't know the clarity still. Any questions? Or will you read your lessons today?